Good morning, good afternoon, and good evening for some of you. Thank you very much for joining us here today in another series of webinars that are organized and convened by Sanitation and Water for All. My name is Serene Malik. I am the Executive Secretary for the African Civil Society Network for Water and Sanitation, and the Vice Chair of the SWA Steering Committee. So today's topic, really, leaving no one behind, something that has been very present within our forums and within the sector, but still remains the questions in terms of, does the money follow the principle? And this is really what we're going to be looking at today in terms of how do we influence budgets to make sure that gender, age, and disabilities are actually adequately covered for within the policies that address leaving no one behind within WASH. All too often, we know that while policies might be in place, sometimes it is not adequately resourced. So we're going to hear from our panelists today, Dr. Mekala, who's going to talk to us about evidence-based messaging and examples from FANSA, Zubair Hassan from DORP in Bangladesh, in terms of the work that they've been doing to ensure that they influence the budgets to include those left behind and the most marginalized and the most vulnerable. And from Aminata Toubifal from IBP Senegal, in terms of how do we leverage data that they come in, and also what work they did in terms of influencing budgets, especially during the COVID-19 time. So thank you all for being here. So first and foremost, would just like to give you a bit of the status quo. What is the status play at this point in time? If I may have the next slide, please. Thank you. All right. So this is information that was lifted from the GLASS reports in terms of showing the comparison between the existence of policies and plans, but also in terms of how they're monitored and how they're financed. Now, at first glance, it's really clear that yes, while policies and plans are there, in terms of monitoring, and especially in terms of financing, there's still a lot of work that needs to be done, which means that all these policies and plans have not been adequately operationalized, or in terms of more work and more advocacy and more pressure and more political will and commitment needs to be built around ensuring that some of this funding actually goes towards ensuring that the needs of the vulnerable are met. So here we have a good overview in terms of what we're looking at. And it's also, let's look at the glass in terms of half full rather than half empty. It is a good start already that the statement of intent is already there in terms of the policies, but in terms of what needs to be done in ensuring that more work is being done in terms of monitoring, but particularly in terms of financing. Next slide, please. Here we just really unpack a bit in terms of what we have, and then just to reiterate the fact again that once again, yes, governance doing pretty well. Governance meaning in terms of, again, these policies and plans. Monitoring, as you can see, some of the figures that are being shown, some as low as 17%. And also in terms of the financing, which really generally reads quite low, not more than 35% in terms of the work that is being done. So we want to hear today from our panelists some of the examples from the ground in terms of how do we make a change? How do we mobilize ourselves in terms of ensuring that we actually have some of these budgets responding to the needs of the people, but also in terms of how is it being done? What does it look like on a practical level? Does it mean more water points? Does it mean bringing some of these wash facilities closer to certain groups? How do we get the people into the decision-making process? Because a lot of this has to do with the decision-making process in terms of how power is being distributed or how this is being done. So I don't want to go ahead and do the presentations for our panelists. So without further ado, I'd like to introduce Dr. Malaka to talk to us about the work that is being done by FANSA on evidence-based messaging and really pushing and creating the call to action for better financing for those left behind. Over to you, Dr. Mikala.
Thank you, Sarin. Thanks a lot. I think you have really set the ball rolling with your first slide itself that speaks about how there are finances, but there is no action on the ground. And I'm bringing you those realities from the ground to you today with this presentation. Next slide, please. Just to give you an introduction of FANSA. FANSA is Freshwater Action Network South Asia. And we have got 400 plus CSOs as part of this network from all the 8 countries in the South Asia, which includes Afghanistan, Bhutan, Bangladesh, Nepal, India, Pakistan, Sri Lanka, and Afghanistan. All the 8 countries have national chapters, and the new national conveners have been recently elected, and then the national steering committees and the regional steering committee is taking all the actions forward and making FANSA a regional network which is vibrant, and then putting all these messages to the global level at various platforms. And our main goal or our main influencing area is advocacy and lobbying, and that too for the WASH services to the vulnerable populations, which are the ones who are hard hit for any of the, whether it is budgets, whether it is calamities, whether it is disasters. These are the populations which are drastically affected every time. And then we work with these populations and see how the WASH services have been there for these vulnerable populations. So as part of our regional advocacy last year, in the year 2020, we have assessed the status of vulnerable people WASH conditions, especially in the COVID context. As all of us know, the COVID has reiterated the importance of WASH. But in reality, when you go to these marginalized populations, the conditions were very, very abysmal, and they are very suffering in reaching the most minimum basic amenities of the WASH. And some of the groups that we covered include the urban shanty dwellers, homeless, persons with disabilities, sanitation workers who are the front line, but then their conditions are so poor. And we also try to look at the people living in hard to reach areas, remote areas, tribals, disaster prone areas. And the findings of these FGDs we have shared with the national and regional stakeholders, which includes government and sector partners. And then we have come up with the actions that are needed to ensure the WASH facilities for this. And based on this finding, we have also developed a policy brief, which we are launching next month for dissemination and focused advocacy. And as again, Sarin has already put it, the consultations revealed an alarming finance gap, resulting in very poor WASH services for these communities. Next slide, please. And I'm giving you some of the most examples of the 4 important groups from the field. And then because of these finance gaps, what is happening on the ground is they do not have adequate WASH services. The physically challenged people are the ones who need more, but then they are the ones who get less. I mean, even within the families, they need to share the toilets, and there's only one toilet per family. And often sometimes it's even the shared toilets. And then the amount of effort for these people to go and use it, but then after using it, the family members do not like it and they discriminate. And then most of these toilets are not accessible. They are available, but they are not disabled friendly. So people really cannot use, and they need to have support from their other family members, and who are often not free when they want to use. And then often it is the care that they need, but then they don't get it. And when it comes to the public WASH facilities, the affordability becomes a major issue, and then they are not able to afford the services. Even in the urban shanty dwellers, and then in urban areas, it becomes very difficult for these PWDs to use those community toilets that are available for him because of these affordability issues. And then even in terms of, queuing and all those other things, there is lack of sensitivity, response, and even within their families, they get the discrimination, leave about the people from outside. So this is the kind of situation that the PWDs are facing on the ground. Next slide, please. And when it comes to the sanitation workers are the frontline soldiers. You all know without them, our households or our neighborhoods are not clean, which is required again mandatory during this COVID context. They clean the whole world for us, but then they live in very squalid conditions, and then the discrimination is there for them at their job place, at their living place, and every time the discrimination is there based on the caste, based on the profession, based on the kind of effort that they carry forward as part of their employment. And despite their work of handling the chemicals and then the toxic materials and medical waste, often you see sanitation workers not having the safety gear, and then they don't have the safety net, that is their medical insurance, their health insurance. None of these things are in place for these sanitation workers who are there to keep the world clean. And then when you look at the informal sector and those people who are on the contract basis, there is no job security, there is no timely payments for them, and often they are with the threat that whether they will have a job tomorrow or not. So that's the kind of situation for these sanitation workers. And then the informal sector sanitation workers, like the rag pickers, like the ones who are working in the waste, solid and liquid waste management units, they just do not have any job security, nor do they have any safety net, neither they have been insured of any payments and job security. So they are the worst hit. Next slide, please. And then when it comes to the homeless and migrants, again, the poverty, unemployment, underpayment, and lack of care pushes them to live on the pavements or on the roads. And then some of these slums are not a priority for wash service delivery to the governments, and some of them are not being even recognized into the government system to provide the services. So they are worst affected. And for the homeless and migrants, again, abuse and denied access at the public wash facilities as seen as a big issue. And then again, when you look at the urban shanty dwellers and the migrants, they need to go long hours or wait in long hours for collection of water, or even in using the public toilets, or often have to go to longer distances for open defecation. And then the homeless people during this COVID context were shifted to the shelter homes, but then the shelter homes did not have any wash facilities, or the facilities were abysmally low, and then that again affected their health conditions poorly. Next slide, please. So when you look at the people who are living in hard to reach areas and tribal communities, and then also disaster prone areas, there is a continuous loss of lives, livelihoods, assets. The entire wash infrastructure gets damaged, and there are no funds for repair or operational maintenance. Often that pushes them into the cycle of this lack of services again and again. And then there is deprivation, poverty, and enhanced vulnerability because of this loss of livelihoods, and then what damaged infrastructure. All the time they are prone to the risk of disease, and then disease, and also lack of facilities all the time. And because of their remoteness, and there is a poor penetration of information, and the basic amenities are not assured, because again the finance gap, because the standard schedule of rates are standard, and they do not change every year, or at least once in 2 years they change, but they don't take into consideration of these difficult to reach areas, or the hard hit areas, or the disaster prone areas, and the standard rates that are there for the other normal conditions are applicable to these people. And then that results again in lack of low quality services and low quality wash infrastructure, again leads them into almost not having any basic facilities for them. Similarly, the medical facilities too. So these are the different kinds of conditions that have emerged out of the study. And then next, please. And what could be the recommendations? As we know, there are different kinds of sector players that are getting operated at country level, regional level, and global level. And even the SWA itself has these different constituencies. We try to put the recommendations for each of these constituencies. What is the most important thing is that there is no data available on this particular vulnerable populations. In any of these South Asian countries, there is no systematic mapping and there is no reliable data that you can depend upon. So that's one of the major intervention that government has to immediately take up on a war footing. And then again, the climate resilient wash inclusive plans are something that government is not really be taken care of. And even though there is a climate change action plans at the national level and there is some policies and plans, but wash inclusion is often not included. And then even if it is included, it is not particularly, the budgets have not been particularly allocated, which is making it inadequate for reaching the vulnerable populations. Again, as I said, these vulnerable populations, like for example, physically challenged, like the LGBTQ, like disaster prone areas, they require exclusive designs and guidelines, which need to be backed by budgets. But often this is not there in any of the national guidelines or even the translation of these guidelines onto the field areas. And then again, we don't see the monitoring and accountability systems to track the progress exclusively for these vulnerable populations. There are wonderful databases, wonderful monitoring systems, but not to look at these vulnerable populations and where the budgets are going that has been allocated for these populations. That cannot be tracked, and there is no one accountable for this particular situation to ensure that the systems are in place. And again, when it comes to the policies for social protection, health and insurance coverage, again, I said, sanitation workers who are the frontline workers do not have their medical reimbursement, do not have insurance coverage, do not have life insurance. And then their safety gear is abysmal, especially in the COVID context. They were getting exposed to the virus every time. And then there were psychological and other issues that have also cropped up because of these conditions. Next slide, please. And then as the governments are gearing up for this COVID recovery response, we urge that the plans should contain the budget to enhance the livelihoods as well as employment for all these vulnerable populations, because unless this is secured in a plan with allocated budgets, they will not be able to come up out of this particular situation. And then as we all know, government need not struggle alone. They can have strategies to pool the resource, leverage support from multiple sources. There are donors, there are private sector, there are CSOs, there are other corporate social responsibilities. They need to kind of pool all this and then have these wash climate resilient plans backed with the budgets. And then the private sector partnerships are very, very important, especially to make sure that the wash services are affordable and accessible. And then again, the mutual accountability mechanisms for financing these target groups is something that very much essential, and government needs to focus on this important item. And then I'm sure SWA is already focusing on this, and we need to really, as a group of individuals working in the sector, need to put the pressure to get these mutual accountability mechanisms implemented in each of the countries. Next slide, please. When it comes to civil society organizations, we are already doing a lot of work, but again, continue to do the same work, build the capacities of the community champions, because that's where our entire work falls on. So we need to really build the community capacities, and also the fellow CSOs who are working in the other sector can also do, because wash is a cross-cutting area and it is required in almost all the programs. And then whichever the CSO is doing the best practices or having successful cases, they need to really document this for wider dissemination. Often I see CSOs are very weak in this documentation process. You need to really bring in these success stories to the limelight so that government's policies can be influenced and governments can take these best practices and for wider replication across the countries. And then CSOs need to strongly advocate and voice the discrimination against these vulnerable populations, and also fight for the inequities that are there in financing and advocate for bridging these finance gap. And CSOs should work in partnership with governments and sector stakeholders. I often make this statement: don't be critical about the government. They are doing their best. Try to supplement and support and complement their work so that in this process, there is a learning atmosphere. By criticizing them, you will become their enemy, but by constructively criticizing and being part of their efforts, then they start appreciating all these things and invite us in a better way. And again, we should play a key role in promoting accountability mechanisms. As I see that in Bhutan, they have a wash cluster, but it's not been really functional. Same thing in Afghanistan. There is a wash cluster that is functioning exclusively made for this. But then again, actively, it has not been implemented on the ground with the mission that it has been taken up. So CSOs should play an important role with the government to promote these accountability mechanisms. And then there has to be innovation in monitoring the progress for the vulnerable groups, because the governments are good at picturizing the databases and all those things, but actually the participatory mechanisms involving the people, we need to really innovate these monitoring mechanisms to monitor the progress of how these budgets are reaching the ground and how the vulnerable have been benefited with these budgets. Next slide, please. And when it comes to the research and learning groups, I always feel I'm a researcher, and then I do what happens to all my reports and all my papers. A lot of them do publish it, but a lot of them evaluation reports get into the government desks and there is no action on them. So basically what these research organizations need to do is continuously evaluate the process, what's happening, whether the marginal and vulnerable groups are getting the wash facilities, what is the kind of process adopted, what needs to be done to improve that. So that evaluation has to take place, and then that has to be provided timely into the government program, so that there is a policy feedback every time, and then there has to be a ritual to follow this so that there are better results on the ground. And then the technical agencies, the technical research organization should promote innovative and low-cost technologies for climate resilient wash. And governments as well as the donors should focus on giving research organizations the funds to do these activities, while the donors should lobby for the dedicated budget allocations from whatever when they are implementing the programs with the government and then supporting the governments. They should insist that part of their budget should dedicate for the vulnerable groups, and there has to be capacities built to all the stakeholders who are part of these innovations. And then there also need to be a scope for developing innovations on the ground before they being scaled up. And then donors also should support the research initiatives to cope and adopt the climate resilient wash intervention. Again, we are talking about the climate resilient wash infrastructure, but we really do not have such kind of foolproof kind of systems, which again are context specific, and the funding should go for these kind of innovations so that the marginalized can be benefited. Like for example, physically disabled, for example, disaster prone areas, or the tribals, or the areas where the drought conditions are there, and the areas where the climate has too much impact in an year itself. So those kind of conditions need to be taken care of. And all in all, what I would like to advise is, last slide, please. When we are working with the communities, what we need to really look at is all the different stakeholders, whether it is private sector, government, CSOs, or the multilateral bodies, or the research and learning partners. All of us need to focus our efforts on reaching the communities equally, inclusively, and efficiently. That's what the message from FANSA side, after having these 100+ focus group discussions in all the South Asian countries. And this presentation and these findings are all due to the community members who were part of this initiation, and then who have helped and supported us in bringing this evidence from the ground. Thanks very much. That's all from my side.
Thank you very much. Thank you very much, Sneha, for that very comprehensive presentation. I know you have a number of questions, but before we get to that, I know there was another question from Neil Dot in terms of maybe there's a problem with the policies and plans that are not translating to the reality of on the ground. So this is something that also in terms of to think about and also linked a bit to data. So what we are going to go into a poll a bit to answer that question in terms of how responsive are our policies and plans when it comes to leaving no one behind. So please do go ahead. We are 93 of us, so we are expecting to see mass participation. Here you go. So poll number 1, please go ahead. Are your national water, sanitation and hygiene budgets inclusive? And in French, vos budgets d'eau, assainissement et hygiène nationaux sont-ils inclusifs? Yes or no? Please go ahead and vote. We're going to keep it for another 30 seconds. We urge you to go ahead and vote. Okay, so a resounding no, they are not inclusive. Though Rutaganda Jean-Marie felt they were. So 26% of you feel they are, but a good 74% of you feel they are not. Can we go to the next question? Sorry, Anjani, was it just one poll or two? Okay, all right. What areas are not considered in water, sanitation and hygiene budgets? So we have gender, disabilities, informal settlements, hard to reach areas, sanitation workers or others. Quels domaines ne sont pas pris en compte dans les budgets d'eau, d'assainissement et d'hygiène? Genre, handicapés, règlement informel, zones difficiles, travailleurs de l'assainissement ou autres. So please do go ahead and submit your answer. Another 35 seconds to go. All right, so thank you for the results. And we're seeing that the majority is people with disabilities, followed by, no, the majority is sanitation workers, no, people with disabilities, followed by sanitation workers, informal settlements, and then gender. And last being the hard to reach. others, I suppose, please go ahead and put it in the chat box for other areas that you feel may not have been taken into consideration. Thank you all for this. And now we'll just move to the question and answer session. So Sneha, I don't know if you had the opportunity to just quickly peruse through the chat box. And first questions that are being asked, or the first question that is being asked twice, is what can the private sector do to support FANSA in the work that you're doing? This is from Neil Dot. And also the issue of policies and plans, and how responsive are they really? And if they're not, why are they not responsive? So over to you, Sneha. Let's just try and keep it within 3-4 minutes. If there are more questions, please go ahead and type in the chat box. Go on, Sneha.
Thanks, Neil. I was just about typing the answer. Now I've been given floor, so let me explain. I think there's a lot that private sector can do it, and especially with FANSA, there are a lot of opportunities that we can really partner with. One is that there is a dearth of low-cost innovations that are needed. The low-cost technologies are, how do we make the facilities that are available, which can be affordable for the most marginalized groups. Often the facilities that are there for those rich people who can afford, but what kind of water filtration systems that we can do for these poorest groups? Can we partner with you and then do those kind of things on the ground? And how are these, like for these different contextual situations, like hard to reach areas, disaster prone areas, and all these things, where exactly can we really field test some of these kind of technologies that are available, which does not suit to these conditions? So that is something that we can work together. And then there are other platforms where we can work together in terms of voicing the issues with the government, because the collective support from all the sector partners is something which the civil societies would require in terms of translating the policies into plans and then into actions, and then especially when you want to really see the practice on the ground. Again, as is being portrayed by Sarin, there are some budgets in plans and programs, but are they being really transferred down to the ground level? Are they being, implemented at the field for these marginalized groups? They just put one pocket, but then that kind of a kitty is not sufficient for these different marginalized groups who have different specifications, different designs. Even within the physical disabilities or physically challenged, you have 7 to 8, 16 categories. When we listed in our studies, according to the South Asian department, we have got about, when we classified them, they are into 16 categories. Okay. Now, so those kind of people require a completely different set of tools and technologies, like, the tabs that they need, and the kind of foot pedals that they need, the kind of ramps they need, the kind of folders they need. All those things are completely different. Why not the private sector fund some of this research on the ground with the implementing partners to test some of these technologies, so that can be taken to the government and then ask them to, give these designs back with this kind of budgets, and then have those technical specifications for them. So there are lots of other opportunities, even at the advocacy, that we can do it. And a part of the answer I've been already given for the second question, but again, let me reiterate. The policy is not being practiced on the ground. I'll just give you one example from my earlier experience. The watershed guidelines in India have changed 5 times. 5 times. By the time the field level inspector has been trained or built the capacities on the first guideline, there is second and third already implemented. Now, the people at the ground level do not know about this new policy which has come into existence. So that fast is the policy change, but then the rest of the activities which are supposed to be coordinating, which are supposed to be translating on the ground, that is not being happening. So that entire gap has to be bridged by coordinated activities of these 4 agencies that I just listed out in the last slide of my presentation.
Thank you, Sneha. But before we move on to Zubair and IPP, there was one question from Arsene. I think you did answer it to a certain extent. Do we need specific policies for vulnerable people? And I think you just mentioned that we have up to 16 categories in terms of disability, and sometimes these policies do not necessarily reflect that. But a very big question, blue sky thinking. What percentage do you think is actually required to cover for the needs of the most vulnerable, the marginalized, and to ensure that we do not leave anyone behind? Just very quickly.
Yeah, the policies alone does not solve the problem, but having a policy gives an advantage for people like us who are fighting in the sector for the rights of the vulnerable. So if there is a policy in place, the rest of the people can fight and then ensure that there is equitable access on the ground. So policy practice need to be balanced and they have to be in place.
And in terms of budgets, if, for example, I think the standard is 0.5% maybe, or 1, 2, 3%, what do you think would be the adequate percentage?
See, it all depends on the percentage of that vulnerable population that is there in that particular country or in that particular area, and then the kind of disaster areas and all that. The proportionate has to be worked out depending on that data that is available. That's why I said creating a database is the most important thing.
Thank you very much. Thank you. Thank you very much, Dr. Sneha, for that excellent presentation, excellent reactions. If you do need to ask more questions, please feel free to contact Dr. Mekana from FANSA. And without further ado, I'd like to move to our next 2 panelists, Zubair, to talk to us about the fantastic work that GORP has been doing in Bangladesh on budget advocacy, and to Aminata Tuifal from IBP in terms of how we can also leverage on their work and the work that they did in Senegal. Zubair, over to you.
Thank you very much. Thank you, Sarin. And I think those who have already participated virtually, good morning, good afternoon, and good evening from Bangladesh. Well, I would like to share where the Dr. Snehalata just kept the ideas, the policy, and how it can be implemented at the ground level. So we have tried to bring some story that how this can be happened if we consider some of the techniques and advocacy tactics, and also use the evidence-based some kind of documents. Then we found that it creates some impact, which means means that if we influence the budget properly, then it really creates some of the change at the ground. Yeah, I would like to share some story or kind of experience of our own work at district level. Next slide. Well, actually, we heard a lot about the budget tracking and influencing budget. But how it is, I mean, how it works, because it's very important. Budget tracking is very important once it is need-based and for which we need to influence. And as we have just heard from Snehalata, that a lot of people are still left behind and they are not reaching by their resources from the government as well as the other donors. So that's a marginalized are also part of it. And we have seen that many of the marginalized are not part of the decision-making process. We call about the different groups of the marginalized, disabled, those who are nomadic groups and religious groups, and also in many countries the young youth groups are also marginalized, but they are not bring into the decision making of the local government systems and particularly the budgets. So and we have seen that budget particularly WASH budget is fragmented. It is not coming from one ministries or one directorates or one authorities. It's coming from different ministries, and it is not properly known by the community that how it is coming up. We have seen that it increased the inequalities, particularly in rural, of course, in urban areas. So through the budget tracking and influencing budget, the benefits actually goes to the poor and excluded. Next, please. Yes. As I said that we have tried to budget tracking and also influencing budget through a process, and that process includes, we have introduced a budget tracking tools that have been participatory process of the compilation of the existing budgets at the local systems and the local governments authorities, and we included the civil society in the whole process at the district level. The civil society, a lot of people are engaged in the process, but they don't get the platform to express their needs. So we brought under them in the one table and tried to link with the local government system, that the lowest tier of the local government systems in many countries like Bangladesh, that's the Union Parishad or Panchayat. So mainly people are the main contact person of this influencing, and also the service providers, the Department of Public Health Engineering. So these things we need to consider while we talk about the influence budget and also budget tracking. In one side, the structures, the systems, and other side is the evidence collecting through the different tools. Yeah, next slide, please. Yes, here it is. We have developed in support with Simavi and Helvetas and other partners. That's the inclusive and gender responsive WASH budget monitoring tools, because we need to monitor through a process. So what we have consulted with the existing budgeting process and also discussed with the local government as well as the community to understand the demand of the local community and how it relates to the allocation, how it goes to the expenditure. As we have just heard from last speaker, that it is not very clear how it is happening from the policy to the ground level. And particularly, it is not very much clear to the vulnerable and the excluded communities by engaging the local government structures, because it is not very open. So we have tried to focus on some of the 10 unions of the local government structures to see through a magnifying glass that what is actually happening. Next, please. Yeah. Then we have seen that if we go through a 4 approaches, it works very well. That's continuous campaign and social mobilization. What is happening? How the government is responding? So what are the policies are available at the ground? That needs to be shared with the community. More campaigns and needs to mobilize the community. Then we have seen that it works very well when the service providers, while we talk about the duty bearers, we need to monitor them, because sometimes they are working by themselves, but it is not happening according to the rules and the structures or the expectation of the people. And continuous lobby and advocacy at various levels, the national levels, local levels, as well as also international levels, and also through tools and evidence, we continue the budget track, that how much is coming, how much is allocating, and how much has been spent. Next slide, please. So, and in the ground, you have seen, I just put these pictures because we need to see that what actually happened, that campaign and social mobilization, because we know a lot of things, but from the papers, or we can understand by our experience, but it actually happens if we really bring them all in front of the discussions. Sometimes we don't welcome the excluded communities and also discuss with them, and especially to know their demand, how what kind of necessity they have related to wash or any other services. Next slide. Yeah. And also, as we mentioned, the continuous asking the local government structure, service providers, that how much they need, how they can come to the discussion, why they did not invite the local authority, local excluded communities, because they are also part of the society. And that's why through the petition submission, this worked very well. It's created a lot of pressure and make the government accountable. Next slide, please. Yes, this is very important to create an enabling environment of the discussions, where the local government representative as well as the women, because you see the sitting in front of the male as well as in the Union Parishad with the local government structures in country like Bangladesh, it's not very much normal. So we need to bring them in the table. We need to empower them. So that's kind of lobbying and advocacy is really important to engage the community and make them empower. Next slide, please. And lastly, that is not least, that's the continuous monitoring, because we always say that off-site monitoring, on-site monitoring, but how actually it is happening in the district level and downwards, there are numbers of service providers, numbers of authority are from the government, but it is not activating. So it's through the tools, it's kind of vehicle to reach them and asking the people's needs. And also a lot of information is coming from them, from the service providers, which can be open up at the different levels of the discussions. Next, please. So this is the tool look like. This is a very simple that there are two types of the structures in the budget. The development budget and also non-development. Development budget includes the many projects and also the donor agencies involvement, etc. Non-development is only administrative and dissemination. So people need to know it also reflects the transparency and accountability. Next. So what we have seen at the district level, particularly this work, we have seen that national budget is not allocated according to the diversified need persons with disability, elderly women, and socially excluded communities. How it works? It actually works budget allocate or budget prepared according to the project of the various departments. For example, project of the drainage system, project of the embankment development, and under the annual development program. So these broad findings, it reflects that it is not focused the people focused. Budget in many cases are focusing on the project. That's a lot of anomalies and a lot of corruptions is also over there. Next, please. So through the whole process, we have seen that if we consider the community and discuss them and bring them in the discussion or the decision-making process, it creates a lot of support from the marginal groups, and they really want to listen. They really want to know how much is coming from the allocation, coming from the local government of the national levels, and how much for themselves. So this is a kind of empowerment giving through the budgeting process or influencing budgets. Next, please. Yeah, and we have seen that it's increased the transparency and accountability through the budget tracking and through the influencing the budgets. Local community, they have written the budget in front of the Union Parishad and also the different authorities, that how much for which projects is allocated. So it is very open, very visible. Next, please. And we have seen that it increased this type of openness and also open discussion helped a lot. In two unions in fiscal years 18 to 19 and also 19 to 20, we have seen the 13% to 19% it has increased. And some cases it is not seen the increase, but due to the total budget increased, the water sanitation budget sometimes not at that level, but it has been increased in the separate line item. Thank you. Next, please. Yeah. And we have also tried to focus zooming in to the disaggregated allocation. It's true that it's very difficult to get the each of the groups of the allocation, but in the district level, we have seen that it is available, but only we need to collect the information from the duty bearers who are the service providers. And we have seen that the excluded people during the fiscal year 2021 in one district, that women as in areas allocation and expenditure is much more than the marginalized groups, is much more than the women, elderly, and peoples in disability. So it is happening. So through the projects they are also getting, but under the projects many are also considered or categorized at different excluded communities. So it's though it is not a very huge amount of allocation for the excluded or the particular group of marginalized, but the process is there, it is happening. So influencing budget and properly budget tracking bring a lot of change. Thank you. Next, please. Yeah, so this is my last slide. Actually, what impact, what made the impact in this whole budget tracking, and it's beyond of its tracking. We have seen that while the budget is open, it shows very transparent and accountability issues of the local government, because it's a budget is a very complicated issues. We have seen that a lot of people are left behind, and it is also in various information we have found it. But how that how we can reach to those left behind community? We need the allocation. We need the sufficient allocation for the wash. So through this transparency and accountability, it can be very measurable that how much is coming and whether it is sufficient or not. And we can also measure the equity issues. And we have seen the budget tracking process is really increase the accountability and also sensitize them, allocate the based on the wash budget needs. That's in the community level. And particularly, it's also ensured to discuss all stakeholders from various layer structures. It's not only the service providers, but also the civil societies, private sectors at the ground. They can also be part of this whole process. And finally, we have seen that it reflects the SDG goal under the 6. There is a 6.C that people support and strengthening the participation of local communities in improving water sanitation management, by which localizing SDG is ensured. So altogether, what we have seen in this one districts, while influencing budgets in through the process, through the proper structures and the documents, it works, and bringing the people in the discussions, that's very important. And not only the technical issues, but also it should be translated through a very easy way, that that budget is not only the numbers of the numerical numbers, it is the planning. So I would like to stop here. Thank you very much for listening.
Zubair, thank you so much for that excellent presentation and giving us the experiences from Bangladesh. I think you have made the strong point that, yes, the keystone of good governance in the sector is participation of women, despite the cultural barriers, participation of the people with disabilities. And we're also seeing a lot of comments coming into the chat that should one of the recommendations actually be separate budgets for people with disabilities, separate budgets for those that are most vulnerable. So please do prepare your questions for Zubair. And we will now move on to Aminata Tulifal from IBP to talk to us about IBP in general, the work that they can do, and how they support a lot of the sector in terms of budget and finance information, but also their experiences for COVID-19. Over to you, Aminata.
Thank you, Serene. Good morning, everyone from Senegal. It's my pleasure to share with you the work that we've been doing with the National Senegalese Federation of Associations of People with Disabilities. So we will be using COVID as an example of how to influence budgets. Next slide, please. Okay, just to give you some context, so people with disabilities in Senegal are highly vulnerable. So while there's an equal opportunity card program and a social orientation law which guarantees them access to health, social services, transportation, etc., these services are not effective. So they have a very low inclusion level in social programs as well as in budgets. And they're structurally stigmatized and excluded in at the community level, but also at the institutional level. So when COVID hit Senegal, we were very worried that people with disabilities might constitute a high-risk group. As you know, a lot of them are street beggars, a lot of them are not engaged in income-generating activities, but also a lot of them are exposed due to their financial vulnerability. So the advocacy challenge was that there was significant pressure on social services demand, but also a high competition over relief resources. But the government put in place a national resilience program, which had a criteria that de facto excluded people with disabilities. But I'll get back to that criteria issue. Next slide, please. So the process of influencing budgets in favor of people with disabilities is a long process, as you can imagine. But these are the key steps that we would like to share with you guys. First, how to bolster the collective agency of people with disabilities, how to collect evidence and also frame a narrative around service delivery gaps and budget exclusion, how to use the compelling evidence to engage with decision makers and also foster dialogue, how to enhance the public participation of people with disabilities, leveraging the skills and advocacy capacities of budget organizations, civil society organizations, and also media networks, how to make sure that we can call the government to action using the compelling evidence, also how to make sure that we sustain engagement and also monitor the commitments that were secured. Next slide, please. So in terms of bolstering what we call collective agency, the main idea behind that was that it's very important to humanize the experiences of marginalized groups. So providing groups the opportunity to tell their story and experiences of exclusion, and basically just avoiding top-down approaches which tend to make a lot of assumptions about how vulnerable groups experience budget exclusion, but also how they experience service delivery gaps. So also reinforcing collective agency. So we did a lot of organizational strengthening, a lot of rights awareness workshops, just making sure that people with disabilities understand that they have rights to social services, but also trying to boost their self-esteem. We've realized that because they're structurally marginalized and stigmatized, they have a lot of self-esteem issues, which might be reflected in the way they're able to advocate for their own rights. We also did a lot of capacity building on budget participation and advocacy. So a lot of trainings at the local, regional, and national levels, making sure that people with disabilities are familiar with budget processes, the budget calendar, how to identify service delivery issues, how to engage with whom, and also making sure that there was a lot of peer learning between the different associations of people with disabilities. We also put in place a COVID-19 monitoring initiative to ensure that people with disabilities are not subjected to further budgetary exclusion in the COVID response. So the government had put in place the resilience program, and they had regional and local committees in charge of the execution and the targeting and the distribution of the COVID assistance. So we made sure that people with disabilities were also part of those monitoring committees, so that they could gain insight into how many people with disabilities were targeted in the program and how many of them actually received the COVID assistance. So in that process, we also made sure that we applied an intersectional approach. So making sure that gender and disability types are also mainstream in the response. Next slide, please. So one very critical aspect of our advocacy was collecting evidence. So not only, like I said earlier, ensuring the participation of FESAF, which is the Federation of People with Disabilities members, in the government's technical committees in charge of the execution of the resilience program, but also making sure that we equip them enough that they can observe inconsistencies in the targeting and distribution of COVID relief kits. So we realized that people with disabilities were not included in the National Registry of Poor Households, which was the basis for the targeting for the National Resilience Program. So they were de facto excluded from the major relief programs. So we also documented a lot of service delivery shortcomings and experiences of budget exclusion. And also we did a lot of research and studies on the norms and discourse on disability, documenting the perception and social and financial vulnerability of people with disabilities. And the main idea behind that was that we wanted to deconstruct the norms and the perception on disability so that not only at the community, at the family level, but also at the institutional level, they were seen as active members of society instead of just people with disabilities. So all the evidence that was collected was used to frame a narrative around the structural exclusion of people with disabilities in budgets as well as in policies. Next slide, please. So in terms of engaging with decision makers, this was also really critical. So we made sure that the shortcomings that were documented were reported to state authorities through writing letters and also organizing meetings with local elected officials and state officials at the national level. But we also facilitated a lot of meetings with officials on the inclusion of people with disabilities in the COVID resilience program. So whenever we gathered enough information showing that people with disabilities were excluded from XYZ program, we engaged with the government, letting them know that, okay, these people are entitled to all these services and they should not be left behind in the COVID response. And as a result, we saw that a lot of local elected officials issued circulars urging the technical committees to include people with disabilities in the targeting and the distribution of COVID assistance, but also several ministries reached out to FESAF to distribute relief kits or dedicate quotas of their sector resilience funds to people with disabilities. But the major result was that about 100,000 people with disabilities that were not initially included in the National Registry for Poor Households actually received the COVID relief kits as a result of all the advocacy efforts, which was really a major result. Next slide, please. Also, in that process, we made sure that the public participation of people with disabilities was enhanced. So also using the power of mass media, right? So we organized mass media campaigns during which all the FESAF members, so the Federation, occupied television and radio shows, highlighting all the evidence that we collected, but also calling the government to action. And also we broadcasted awareness and advocacy reports on people with disabilities in prime time in the 7 coded languages of Senegal, but also made sure that people with disabilities were increasingly participating in decision-making processes at the local, regional, and national levels. Next slide, please. So one very important aspect of our advocacy was also building coalitions with organizations that are able to amplify the voices of people with disabilities. So we really leveraged on the experience, the advocacy capacities, and the network of budget organizations, civil society organizations, also parliamentarians, to ensure that disability was mainstream in the COVID response. So one very brief example of the work that we do with parliamentarians is that we do sometimes advocacy events, such as dinners, where we convene parliamentarians from different commissions, let's say the Health and Population Commission and the Finance Commission, and representatives of the government. And we talk about the different issues that people with disabilities are tackling. And we make sure that the government not only hears them, but also commits to bettering their situation. So we make sure that the conversation on disability is propelled. And one example of the successes of our coalitions is that the FESAF program manager for our disability program was nominated as a result of our coalition in the monitoring and execution committee for COVID operations called COVID, which was really important because we were able to gain insights into how the resources were being executed and making sure that as a representative of the Federation, he made sure that people with disabilities were not left behind in the response. Next slide, please. Thank you. So in calling the government to action, just like Dr. Mikala said earlier, it's very important to not only be a watchdog and ensure the transparency and holding the government accountable, but also acting as a collaborator. So we, on one side, on one hand, engage with the government and we're able to stimulate prompt responses to advocacy campaigns, but also while we were doing that, we were also denouncing all the shortcomings documented. So organizing press conferences and calling the government to action, widely shared reports and broadcasted on major media outlets, which really contributed to creating pressure around people with disabilities demands, but also fostering government action. So I think the key here is to really not only hold the government accountable, but like Dr. Mikala was saying, collaborating with them, engaging with them, and also making sure that we don't make too many assumptions about their incentives, but also their political will. Yeah. Next slide, please. So in sustaining engagement and monitoring commitments, this is also very important. After we secured a lot of commitments from the government, which some of them were already fulfilled, others we're still monitoring. We are still doing multi-stakeholder dialogues, bringing together sectoral ministries and ensuring that government disability is not just seen as a medical issue, since it's under the Ministry of Health and Social Action tutel. But we also making sure that we do budget review workshops and also regularly engage with government actors and local elected officials on people with disabilities issues. But also we have set a monitoring matrix to keep track of the commitments and also identify advocacy opportunities. Next slide, please. In terms of lessons learned, we've learned definitely a lot of lessons, but some of the key lessons that we would like to share is that first, next slide, please. It's very important to go for organic approaches. So not really reinventing the wheel, but using the existing local resources, valuing them, and showing people with disabilities that we care about their experiences, also giving them the opportunity to tell their own story of budget exclusion, putting them at the center of all processes. Next, please. Also, building reform coalitions is very critical. So not only for creating synergy around the monitoring of service delivery, but also just constituting a critical mass that is capable of engaging with decision makers on issues that affect vulnerable groups. Next, please. But again, like I said earlier, occupying media spaces is very, very important. We need to make sure that people with disabilities can engage with government officials, but also everyone in the accountability ecosystem to strengthen state accountability, but also reinforce the participation of vulnerable groups in decision-making processes. Thank you. I think this was the last slide. Thank you very much for your attention. I'm looking forward to the questions.
Thank you very much, Aminatu, for that very comprehensive, well-structured, point-by-point presentation on the work that IBP has been doing. So we're going to go for a round of question and answers. So I'll start with Zubair. Zubair, I think you've managed to take a look at a bit of the chat box, where a lot of the questions are around how useful is it to use the human rights water and sanitation to strengthen accountability, for example, human rights institutions, raising awareness, but also the issues of the parameters and ensuring that these indicators are reflected within the policies and plans. So if we could start off with that, Zubair, go on.
Yeah. No, thank you very much for giving this question. I think the whole idea of influencing budget is reflected the right to water and sanitation aspects. For example, if we consider the availability, accessibility, quality, and also affordability principles of the right to water and sanitation, that all of the principles are very much related to the budgeting purposes, that how communities are able to access their right to information, the right to budget issues. So that's accessibility is very much important and reflecting the rights issue. And secondly, the affordability also. This is very important. Those who are marginalized, poorest of the poor, and sometimes they are much more willing to buy the mobile and also top up the mobile than the toilets. In that case, how they think how it relates to the right to water and sanitation. In that case, what we have seen that the knowing the harm of the public health harm is also important to this process. So, and in that case, investment of the local government is important for capacity building of the communities as well as the awareness programs. So once influencing budget or the budget tracking is a central issue of the many aspects, particularly for addressing human right to water and sanitation. And at the same time, I've also seen some of the questions related to disaggregated data, that how, what are the challenges to collect this disaggregated data. I would like to confess in this purposes that's when we talk about the marginalized and also the gender based budget or kind of things, then we only talk about the women only, but it is not women only, the gender based, it's also the men, and also and if we go beyond of this, that elderly, nomadic groups, cobbler, these different types of social workers are involved in the whole marginalized communities. So it is really very difficult because country does not have that type of database. So we need to we need to depend on the social departments of the district level, and they have some kind of average information or not the very specific disaggregated data. So so it's many countries and like Bangladesh already started the household income expenditure survey, and based on this they are now collecting that is aggregated gender-based data, so that it can directly address the household levels. But we have the problem. It's really important, because leaving no one behind. If we want to identify that who are the left behind, it's very important to identifying them. And in this pandemic, lot of new poor has been arisen in the systems, and particularly 5% has been increased from the 20.5% of poorest of the poor in Bangladesh. So that's now we have more than 25% as poorest of the poor. So this is really we are in really in deep challenging situation, and we have to work on it. And at this last point here, we have seen that the not only the demand creation by the community or engaging the community. Here, some of the learned participants, they mentioned that community also need to capacitize. Yes, I also agree. And that's why we also introduce some coachings, some open discussions with the community on the information, right to information, about the policy issues, what are the available policies are active in the ground level that have been introduced at the ground. So I fully agree that capacity increase of the communities are also important to improve the situation.
Thanks, Zubair. You have the million-dollar question, Zubair. Did the budget tracking result in increased government investment to sanitation in Bangladesh, or were there signs that the government has committed towards increasing financing for the sector?
Yeah, I think it's a good question, and it's a continuous process. It's related to many factors. It's related to improvement of the governance, transparency, participation, and even this understanding and political will is very important. That engaging parliamentarians and talking on this issue at the parliament is very important to make it happen. So budget tracking through the process, what I have shared, this is some increased already happened over there, but it is not maybe sufficient, but systems are there. It's already continuing.
All right.
So it is happening even in many countries. IBP is also working. They also know very well that how budget tracking is working better.
Yeah. Thank you, Zubair.
Thank you very much.
Aminata, I think the IBP demonstrated a good example of building political will. This is a question that has come up quite a bit within the presentations. Maybe if you could unpack that for us a little bit more. And another very interesting aspect that you mentioned, which is the role that a lot of civil societies have to grapple with, that you're seen as a friend or being too close to government, but at the same time, you need to manage your oversight role and that of dissent. So I thought it was really interesting in terms of, yes, we are close to the government, but we also document their shortcomings. So maybe just to hear a bit more on those 2 points.
Thank you very much. I think it's kind of a complex issue, right? Trying to create a balance between holding the government accountable, but also documenting shortcomings and making sure that we call them to action. But I think what's really important here is trying to just build evidence that the government cannot refute, right? Yep. So when we were working on our studies and research, we collaborated with the Sheikh University of Dakar, so well-known researchers, a lot of very respected academicians. So it was very hard for the government to not engage with us because they know that the evidence that we're presenting is solid evidence, it's rigorous, it's representative of the needs and aspirations of people with disabilities. I think this was really critical, but also in terms of political will. I think oftentimes we make assumptions about what the government wants and does not want to do, but I think unless we engage with them, we don't know really how they're moving forward. So I think it's really important to engage with them, but also to make sure that we understand that sometimes it's just that resources are very limited, but also we really do think that governments are aware of what's happening on the ground, but a lot of times we realize that they don't know. So there's a clear disconnect between government, unfortunately, and populations, and they don't tend to use the community resources. In Senegal, we have a lot of grassroots organizations that are doing amazing work, but the government is not aware of their work. So what IBP tries to do is just really bridging the gap between state interventions and also bringing together the government and populations, which is not always an easy task. But what is really important is also trying to engage a lot with populations and those grassroots organizations so that also they can deconstruct their image and perception of government. So it's on two sides, right? The government does not know what populations aspire to and what they're doing on the ground, but also populations are very reluctant to engage with governments because they think that they genuinely do not care about their situation. So yeah, it's a very complex issue, but I think working with government and civil society organizations and parliamentarians which have that independence that is very much needed is very critical to ensuring that government is more actively listening to populations. I hope that answers a bit your question.
I think so. Thank you very much, Aminata. As a matter of fact, this is a question that is being raised quite a bit, that as civil society organizations, you have to work closely with government, but then without following out the role of oversight and watchdog. So I think this was a brilliant example of how this delicate balance can be achieved. There is a question generally in terms of Salima Bokoum that has asked, can you share a bit of the results and the work that was done with the parliamentarians? And maybe for Zubair or Sneha or even you, Aminata, has any kind of advocacy been done with national statistic offices? So first over to you, Aminata.
Yes, thank you. So yes, we worked a lot with parliamentarians. So to give you an example, in 2019, so the government has to produce the Equal Opportunity Card, which entitles people with disabilities to all the social services and all their disability policies, right? And the government has to produce 10,000 cards every year. But for 3 years, in between 2016 and 2019, they had not produced any cards. So if they don't produce the cards, the people with disabilities cannot effectively access to the services that they're entitled to. So what we did was that we documented all the evidence that the cards were not produced, looked into the budget execution issues, and then we convened an advocacy dinner with parliamentarians of the Health and Population Commission, the Finance Commission, and different state representatives, the Ministry of Health and Social Action. And we brought forward the evidence that was raised and also called parliamentarians to speak on the different issues in terms of budget execution. And we drafted a memo that was submitted during the plenary of the National Assembly to the Minister of Health and Social Action. And immediately after that, the government committed that they would produce 5,000 cards, which is 50% of the annual objective, but still was a good start. And they produced those cards in the following month. After that, what was important was that since the conversation was sparked, we were able to keep engaging with the Ministry of Health and telling them, okay, so you have 10,000 cards that you have to produce every year. We are aware of the budget issues, but we need you to at least allocate enough resources to the Equal Opportunity Card program so people with disabilities can effectively access their services. Because there are two issues. The cards have to be produced, but the services have to be effective. So we're dealing with those two issues, and we need to make sure that we engage with parliamentarians, which have a lot of influence, but also are able to keep holding the government accountable in National Assembly plenaries and individual committee sessions. So that was one example. Sorry, yeah, I'll keep it at that for now.
Thank you, Aminata. I've seen that WaterAid, Ranjan has mentioned that they have started doing work with the National Statistics Bureau for the developing of national wash accounts. Zubair, maybe just very quickly in terms of advocacy being done with statistics type of institutions or data institutions.
Yeah, I think the involvement or the result from the parliamentarians is very important because they are the lawmakers, and in Bangladesh, due to lobby and advocacy, recently Bangladesh has got the Water Act, and the rules of Water Act is also in the ground. Based on this, a lot of structures already developed, and people are now participating in the whole process. So though the parliamentarians' role is to play the lawmaking, but they are also engaged in the local involvement and local politics. They have some constituency development fund, and it is really important for the local level that how those funds are really utilized and how it is go for the wash purposes. So we have started to discuss with some of the parliamentarians, and it also depends on the opposition and also ruling parties. So this is also sometimes depends on the engagement. Is the individual engagement or the engagement from the party? So the engagement of parliamentarians also depends on the interest of the issue or the subject. And water, sanitation, hygiene is still not yet we found very interesting issue at the country like Bangladesh. So it's really we need to work on it. And what you have mentioned in the one of the accounts, wash accounts in developing, this is a really unique work is going on, that once we can get this wash account, because as we mentioned that our wash budget is fragmented, it is not in one ministry or one directorate, so it is coming from various ministries. So if we get the wash accounts and we can get the clear picture of disaggregated data as well as the allocation, then it is really helpful for the decision makers and the policy makers to take proper planning. Thank you.
Thank you.
Over to you, Sharon.
Thank you. Thank you very much, Zubair. Thank you to all for your brilliant presentations, and thank you to our participants for joining us here today. I'm going to hand over to Anjani for wrap up and way forward. Anjani, over to you.
Thank you so much, Serene, and thank you all for joining the webinar today. Just a quick note that we've noted down all your questions, and if they are left unanswered, we will reach out to you bilaterally. We will also be sharing the recordings and the slides right after the webinar. You can also check the recordings of all the last webinars and presentation in this finance webinar series on our website, and I'll place place the link for it in the chat. Thank you so much again for joining. Thank you, Serene, for moderating the webinar today. Thank you from our side as the SWA Secretariat and all our co-conveners who helped us through this month-long process of building capacity and doing advocacy via this webinar series. Thank you so much. Take care and bye.
Thank you all. Bye, everyone.
Thank you. Thank you, Serene.